I'm all right. How are you?
I'm taking deep breaths.
I took a
I'm
quick
doing
look at
just
the
great.
culture results and they didn't name a bacteria.
They won't. They did Bacteroides,
Oh,
a
okay.
species of Bacteroides.
Oh, okay. So this is something different.
This is an anaerobic bacteria. Oh God, you better not put this online. So anaerobes are hard to grow and they're hard to test antibiotics for. Anaerobes mean they don't require oxygen to live. How much sense does that make? It's growing in a nasal passage. But what happens is it gets into the tissue and or the bone or the cartilage, and it's a bit of a mother to get rid of. And then because you can't get accurate culture results, you go, okay, they give you drugs of choice. Clavamox, chloramphenicol, clindamycin is actually a very good drug for anaerobes. I don't think we've been on that. Interestingly, they found some yeast. Fungus. That's common. So what we need to do is, they asked if we wanted yeast identification, and I just got this. I had to call the lab for it. I'm like, Where is my culture? Why is it not here? Well, they kept going back and back because of the anaerobe. So initially, they gave me a no growth. Then they gave me a suspicious for bacterial growth. Then they wanted to do further. Then they got a yeast, and then they went back and found a Bacteroides. So it took me a little bit of while to get this. They just gave me a final on 2-1, which, what is that, today?
Yeah, and those are none of those identify the Morganella and the Enterococcus that the other culture had.
Those are aerobes, though. This is anaerobe, and so basically what they did is they said there was no anaerobic growth because we had been treating it.
Okay.
So they came up, because on this one, I ordered an anaerobic culture.
Okay.
I ordered both. On the one prior that you had,
Just aerobic?
No, I think you had a dual culture, but maybe not. I'll have to go back and look. But anyhow, on this, they grew no aerobes, which I would expect they wouldn't have because A, we got better, B, we were on meds that should have killed it per what the culture said. I had a feeling there was something else going on. So anyway, I need to call the lab and have them ID our yeast. Is it Malassezia? Is it Candida? Is it what?
What would cause that?
Fungus? Breathing in anything. Fungal spores.
Her big old nostrils, that's pretty easy.
It could have been there from her food. It could have been something she's rooting around in her cage and something had fungus on it, yeast. Yeast is kind of in the fungal category. So I need to ID what it is because my worry is I can put her on itraconazole or systemic therapy. My bigger worry is I'm going to need topical therapy for fungus, and there's only so many things that can be tolerated on raw tissue, mucous membranes like that.
So are they going to test the yeast to see what kills it?
They left me a note, and I just got this. The report is 2-1. I'm like, where is this? They've been messing around with it all week trying to figure out what they had.
Yeah.
So they reported this back to me on the final was yesterday. They said, if ID is needed, contact lab order test number M080. The girls are going to call and order it if they haven't already.
Okay.
So that's going to take us, they might do it through the weekend, probably until Monday or Tuesday to get a result. But then I'll know the name and genus and species of our yeast, and they should be able to tell me what to use for treatment.
Is that something you could prescribe?
I'm going to send you home with some Spornox.
Okay.
Just because I know how these things go, Brad.
How was the
Okay, let's talk about that
debride?
Because I was like, holy schnitzel. So when God, I am the worst artist ever.
Here, you can hold the subject.
Come here, baby girl. God, my pretty. So, hi, baby girl. If I looked at her nostrils from a side view, you should have kind of like, you've got these folds that they start up in the front and they go all the way into the back of the nasal passage. And they kind of separate the nasal passage into like 3 little tracks, okay?
Right.
On the good side, the track on the bottom, which is where the hole was that I was seeing through the septum.
Right.
So like when I looked through this nostril, through the hole in the septum onto the other side, in the floor, I see this hole that has full of pus.
Yeah.
And then I can't see anything beyond that. Now, I can't tell if that's the floor of the lower passage or if that's a little fistula. Well, that ended up being the floor of the lower passage that had a membrane grown all the way across the whole back side.
But it's good that it's the floor, though, right?
Yes.
Okay.
But if you saw what I suctioned out of there when I busted through it, I was literally like, I did not just see that go through the suction tube.
Poor girl.
I felt so badly. I'm like, little girlfriend. And I can't see that on an x-ray because it's soft tissue.
She's never breathed a breath of fresh air before.
Oh my God, Brad, I felt so bad. I'm like, how would I ever know that's there? I even retook x-rays beforehand because I'm like, is there something I'm missing? And I took every oblique, straight, lateral, AP, you name it. And I could not. Hi, baby girl. I'm sorry. Anyway, I couldn't see anything out of the ordinary, so I went in there. And when I broke through, when I started lifting the membrane to kind of open, like, I have a hole like this, and that's it. And there's pink tissue all around it. Well, what had happened was there was like a track, because on this side of the septum, at some point it was raw, and the tissue just adhered to it and healed across. So when I don't go in the good side. We've never really had an issue there that we knew of, and I can't see anything on an x-ray. So when I was trying to figure out why am I seeing pus on that side the last time, which is the first time I've seen it, that's when I got in there with the scope, and I'm like, what the heck is going on? And I could barely get it around the corner enough to see the hole, but I could see it. Well, I got in there with a probe and I started lifting the soft tissue, and I saw that it just peeled right off the septum.
Good.
And there's the floor of the nasal passage. So I opened it up all the way back, but all along that whole floor, it was like a shelf covering just a soup bed. It was disgusting.
Poor thing.
Poor baby. I feel so bad for her.
I see like her good side tear duct. It has a little bit of blood, and that's where it used to have little pieces of infection. I'm wondering if whenever you did the debridling, like now that it's probably a good thing that blood's coming out now, because that means whatever was before causing pus to come out has been removed. I'm assuming.
I would hope so. I mean, I would think that it's all open now. I just feel so bad for her. And then in the very back of this bad nasal passage, remember I told you how the tissue just is abnormal, and you could see that yourself. If you look up in there, you'll see just like little cratered soft tissue. That's how soft tissue heals, especially in the nasal passage. I get that in the prairie dogs. I get it in other squirrels. And just in one of the little pits was some pus that was just like sitting in it. Yeah.
Okay.
But it's just like a little C-shaped little spot in the back of the soft tissue. It's not deep. It doesn't go anywhere. And my guess is going to be that it's the bacteria and the yeast that's just in there. It's not like there's a new infection or a place for me to go and undo anything. It's just the presence of the infection.
Right.
The place to do something was through here. And, you know what? It actually worked out okay, because I have to improvise as I'm doing it and figure out what tools to work with and what instruments I can sneak around the corner there. And I actually have a long metal probe that has like a little bead on the end of it. It's actually a feeding tube, for little tiny
I'd
creatures.
love to see that. Like, I can only imagine how tiny these little instruments are. I'd love to see them sometime.
Oh, I can bring some in and show you. But anyway, I had to keep flipping back and forth between loops, scope, and then I'd have to change the light out because I needed a brighter light, then I needed a dimmer light, and I can't adjust it. So that's why it took me so long. Someone made a comment
on the last vlog that when you saw the pocket of infection on the good side, just take some tweezers and get it out. I don't think they understand. Oh my God.
If I had tweezers that small, trust me, I would use them. I ended up actually ordering, like, they call them micro alligator grabbers, like micro.
I was wondering if they were actually considered microscopic.
They are, and I ordered a pair, and I needed them anyway, but they worked really well for me today. And I was able to that septum has a little give to it because it's cartilage, but of course I have to be careful because I don't want to tear it off. But we actually did really well with that.
Did you end up opening up that septum area a little bit?
No, not at all.
Okay. I thought you were gonna.
There was like dried scabby material, but it was just in the front of it. And when I pulled it off, it didn't really. It's no more open than it always was.
Okay.
It just doesn't have a big scab in the front of it now. She did really well, Brad. It was just.
She had a good week.
It's a long journey in there. But now when I look around the corner, her nasal passage looks the way it should. But you'd have to be able to look through a scope to see what I mean about how I don't have a straight shot in. And so I'm looking through the septum like at an angle, you know, kind of this way. And I can't see the full anatomy the way I would like to. Whereas here, we don't have any anatomy because the tooth like made it all go away.
Right.
And so when I look through there now, I can see all the way into the back. And then I see the fold and I can see the middle passage. And then at the top passage was always there.
Okay, so in layman's terms, there was the septum opening in the front, and you were curious about the septum opening in the back. And you're saying you could see the one in the back now, and that it's clear?
Nope, I'm talking about the nasal passage. So
so just like the sinuses?
Yeah, sinuses. Sort of. Nasal passages lead to sinuses. Okay. So if I were to look, I know it. This is talent right here, guys. I'm holding the patient and drawing, and I'm a terrible artist.
And she's not even fighting it.
I know, she's like over it. So if this was the nostril opening, it's kind of like this in the back. And so you have a fold up top, a fold here, and then you have another little fold here. And so when I kind of drew this a little off. But anyhow, when you look, you have a little passage through here, and then you have a fold of tissue, and then you have a passage through here. Well, if you looked at this lengthwise, that passage should be straight and open and clear all the way back. That would be this passage. Basically, I had an opening right here, and this was all covered in pink tissue. And there's no way for me to tell without being able to look at it straight on when I'm looking around the corner. I can't tell that that's abnormal or not. So thinking that the top of this is the floor of her nasal passage, because that's really all I could determine. When I went in here with an instrument, I have that big long probe that has a little ball on the end of it like that. I entered that in there, and then when I went to probe, it passed all the way through. And I'm like, okay, the only thing that could be there would be the floor of the nasal passage. Good. And that's when I realized that basically you had a membrane that was grown, and the septum is right here, and it was adhered to the septum. So when I got in here, I take this and kind of lift it, and I'm doing this like half blind because I can't keep the scope there and work, because the actual size of the hole is literally barely that big in real life. So I am working through a hole about that big. Well, you know how big it is. That actually might be a little generous. Size, I don't think. It's close. You're right, though. It's probably more like that. That is the real life-sized hole that I'm working through with
2 instruments.
Instruments with a scope out here. And then I have to angle our head like just perfectly so I can angle the scope kind of like this way from afar and put the instrument in and work. But anyhow, thankfully the septum has a little give to it, and I was able to kind of pull it this way a hair enough to be able to kind of see around the corner. So my opening is right here and I'm looking this way. Anyhow, once I got this membrane peeled off, I'm like, oh my God, that's the floor of her nasal passage that's covered over. And it basically did make a fistula. And then when I have an attachment to my suction that's like super tiny. It's a catheter. And when I got in there, I was like, oh my God, what came out of there was just trapped in there. Awful. So my hope is, now that we know we have an anaerobic organism that's in the tissues and maybe even in some of the bone, we need to shift gears on antibiotics, and then I need to have the lab ID the yeast or fungus that's in there.
What do you mean by shift gears on antibiotics?
We need to probably, we've not been on clindamycin, correct?
She's been on it before, but not since the infection is...
Original, correct? Because I didn't, your very first vet that did the tooth trim put you on Clinda.
She might have. I know I have 2 clindamycin pills at home that I could...
Well, we'll figure out how to compound them, but that is probably one of the best antibiotics for infection that's in bone, and it's really good at killing anaerobes. There are very few antibiotics that will kill an anaerobe.
Okay.
They recommended chloramphenicol,
I've got half a bottle of that.
metronidazole.
I don't know how long those last.
I'm not a huge fan of Metro for anaerobes in the bone or the sinus. In the gut, I'm all about that. But for clindamycin, for bone or cartilage, I want clindamycin or chloramphenicol.
Okay.
I would prefer clindamycin. We've been on chloro. It's not, it helped, but it's not knocking it back. So that tells me that. And bacteroides, it's a pain in the rear end to get rid of.
All of course, I wouldn't expect anything. She only gets the best.
Girlfriend.
The best bacteria.
Sorry, Goo.
The best
She'll
yeast.
probably have a yeast that I've never heard of, and it's going to take something that I have to order from like Zimbabwe to get rid of it.
Actually, we have a vet in South Africa.
Yeah.
Yeah.
Sometimes they can get things that I can't.
Maybe she can send it to us.
No, Canada is usually my go-to for that, but I'm pretty sure we'll be okay. My biggest
Sabrina.
concern is what topically do I need for the yeast? So we'll see. I had to
Are there a lot of choices?
No.
Okay, good.
And again, they can be very scalding to the nasal tissues. I had a squirrel like 3 or 4 years ago that had really bad aspergillosis, which is a fungus that gets up in the nasal passage. And I ended up using, I think I got like 2% clotrimazole. It's a liquid, antifungal liquid, and the pharmacy had it, and I did soaks. And I think it took me 3 soaks, and then we did the oral itraconazole, which I'm going to send you home with today.
Did you do a soak today?
Nope.
Okay. I know you're tempted by it.
I didn't want to because I went in and trashed all the tissue. It's all torn apart, and
Yeah.
I had to go and like kind of.
I can see the residuals.
I don't want to say reconstruct it, but in a way I did because I had to pull that whole membrane that was attached to the septum on the good side completely off, scrape through there, open it, debride it. Means like go and scrape it clean and get all the yuck off of there. And then there was a little bit of cartilage that, came out that was crumbly and yuck in the very back. So I had to remove that, and I didn't want to put anything on there that was just going to scorch it.
How many cases do you think are similar to hers?
In my career of hundreds and hundreds and hundreds of squirrels, I've had 3. Literally 3.
I'm surprised that's 2 more than I thought.
I've had a couple of other squirrels where their teeth have grown into their skull that way, and I believe it or not, I actually had a squirrel not too long ago that there was a malocclusion and the top teeth had grown in and curled and grown up into the palate, broke off. The owner didn't know because its tooth was short, and it had a severe infection. And so I went to go do surgery. I'm like, what in the God's name is this? And then I saw this thing in the palate, and I could tell it was a tooth.
Mm-hmm.
And I pulled out a chunk of tooth that was curled up in there. This is before I even took an x-ray. Just do the exam to start with. And that one was horribly infected. It had big pieces of dead bone in there. And then just this last year, these people caught a squirrel that they were feeding. They didn't recognize that it had problems, and it had a really severe underbite and very similar to her, but the tooth grew a little lower and did a little more. Yeah. One grew and curled up into the cheek, but the other one grew lower into the nasal passage, and it kind of curled around a bit, and it created a disaster. But I didn't run into the chronic infection like with her. On the other one, I did bad. I don't think I couldn't pull that. I could never resolve that one's infection.
Really?
The one that had the palatal tooth.
Well, I think we're
doing good.
And
this helps me because now I know there's a little more to our story. Plus, I don't care what I did for treatment. Had I not found that track, I would have never, ever gotten rid of this infection. Even if I, infused antibiotic in there that was perfectly fine to kill the bacteria, it's trapped in that membrane and in that pocket. So unless I get that opened up, I would never resolve it.
So when you've got these culture results and it says like a certain medicine is supposed to kill a certain bacteria, but honestly, she's been on most of these medicines before. Is that because there's a threshold when there's so much bacteria, the antibiotics are ineffective?
No, probably what the issue is that it's trapped in dead space. That's what I'm saying about, had I not gotten this fistulous tract there, that had I not figured out that it was there, it's the same concept. You have bacteria that sits in a dead space. So when you put meds in and you put topical meds in, when you give oral medication, it goes to the edge of the tissues where the blood supply is, and that's it. So then you have hollow dead space because we have a nostril. We have an ear canal, vaginal canal, oral canal. When you have dead space, you have to use topical treatment. Well, I'm shoving drops in and you're putting meds and we're injecting and doing everything by the book.
Okay.
But you have a pinhole in the floor of this good nasal passage that travels all the way to the back of her nasal passage that's trapped bacteria. There's no way any medicine is going to get in there enough to kill these organisms. Okay. And with the hole being as small as it is, and you're putting liquid in there, and this hole is filled with pus, it's not going to overpower that thick pus and get behind it and get in there.
That makes sense.
So that is probably more why, because we had organisms that were trapped in a space that we couldn't get drugs into.
I thought we just had too much bacteria, and it's not effective until you kind of get rid, debridle it, most of it, and get
Not typically.
Okay.
Sometimes you can have organisms. Sometimes it's tough to kill it when it gets in a bone. If you look at bone under a microscope, it looks a bit like a sponge. It's got all these caverns and channels that run through it, and so that's dead space. And so getting medications to penetrate through all that, it can be a challenge. And now we know that in that we have an anaerobe. So there's only a small handful of antibiotics that'll get rid of an anaerobic bacteria. And we really kind of haven't hammered away on those so much. Even if we had, it wouldn't have mattered because I had a big long tract of dead space, literally about that long, well, as big as her head is, about that far back, that literally her nasal passage ends about right back here. I'm sorry, Sabrina. So you had a thing this long, like a little tunnel underneath that was literally filled with infection.
Is there any evidence of the infection reaching her bone?
That I can see, no, but I assume it's there. But that I can see it on the x-rays, no.
Okay.
No. What was here, we did have infection in the bone here before, and I nipped all that away.
So basically the plan now is to wait for these yeast.
Yep, I'm gonna send you home with some oral antifungal that we're gonna start. We're gonna go to clindamycin. What drops are you given? Gentamicin
and amikacin, and then orally the Clavamox.
Keep the nasal drops going. Just put them in the nose. Try if you can sneak it around the corner. You could take. You know what you could do? You're good.
Syringe.
You can take the needle because it'll deliver a micro drop. So here's the problem that you're gonna have trying to get it through the septum. Your hole is tiny. Your drop of fluid is bigger than your hole. It's gonna sit on top of it. So what you want to do is draw it up in an insulin syringe, and you want to deliver the drops through that because the drop is smaller than the opening. So instead of sitting on top, it'll actually go through.
Okay.
And or with a little power behind it, just give it a squirt.
I noticed it'll squirt really thinly. So yeah.
If you can pull that off, you are good, Brad.
She's normally really great with staying still.
Honey, you're so sweet.
Administering drops in her nose is like her one Achilles heel as far as flinching.
You have to cover her eyes so she doesn't know you're doing it. Pull that off and you'll be my hero forever.
Okay. I can try
You make
that.
a little blindfold for her.
I know.
Aww.
She keeps those big old doe eyes staring at me.
You're probably going to hear a little bit of the... Expect that. Okay. There's a lot of swelling and there's going to be blood clots and a little bit of mucus in there, and she's just moving that around when she's breathing.
Yeah, I figure in a couple days it'll pass.
No, baby girl, it will. You might need to grab onto that neosynephrine and just kind of tighten things up a little bit, get the swelling and the inflammation down. I put some in her recovery because she didn't want to stop bleeding for me. Noses bleed a lot,
Yeah.
And so anyway, that stopped the bleeding for us, but... On the big scale, I was thrilled.
Good.
When I went to go into this, I'm like, okay, it's been a long Friday, and
I can tell.
I'm going to take a deep breath and just take my time and sort this out. And when I first looked in there, my wheels were spinning, and I'm like, how the hell am I going to get something in there to figure this out? But I did.
Thank you so much.
You're welcome.
Hey, thank you, Sabrina.